Hi, everybody. This is Jill Procopio. We are about to get started. Thank you all for joining us. We are going to talk through some of the additional supports that Autism Speaks has been working on in Massachusetts and nationwide to assist with the COVID-19 crisis. And first, we're just going to start with a recap of our mission statement. I think it's always important to begin with that and really remind everyone what we're here to accomplish. So we are dedicated to promoting solutions across the spectrum and throughout the lifespan for the needs of individuals with autism and their families. And the key areas and the ways that we accomplish that is through advocacy and support, increasing understanding and acceptance of people with autism, and advancing research into causes and better interventions for autism spectrum disorder and the related conditions that go along with it. I'm really excited to introduce Judith Ursitti. I'm sure many of you know her as she lives right here in Massachusetts. And Judith, take it away.
Absolutely. Thank you, Jill, and thanks everybody for joining us today. We just wanted to touch base with you and talk with you about what's going on in DC and also here in Massachusetts that affects the autism community. It's so important that we gather and focus on people with autism, their families, their providers, their community, and so that's what we want to do today. So thank you guys for taking time out of your lunch to join us. I know you're all experiencing different challenges related to COVID-19. Wow, what several weeks it's been. And I actually today was kind of yelling and saying, I'm really ready to go somewhere else and do something else. And I think probably the rest of you feel the same way. And people with autism definitely are struggling with just unforeseen challenges that we haven't experienced before. Schools are closed. So educational services that are so important aren't there. Our day programs are closed. Clinics that we frequent, many of them are closed. We've shifted to telehealth, which has been hard for some people, great for some people, but it's just been a huge adjustment. Mental health supports are needed, not only for parents, but for people with autism, for siblings, for our community. There's that lack of connection that we count on, and maybe you don't realize how much you count on it till it's not there. Going to church every week, or going to get ice cream at JP Licks, or going to the grocery store. Those are outings that can be really just meaningful for a person with autism, that connection with others. Many of you know Jack loves to go to Outback Steakhouse in Norwood, and we go there. Well, actually, it's not Norwood anymore. The Norwood closed. We actually go to the one now in Randolph. And we go there every week. Staff knows Jack. We walk in, they know his order. They know he wants wings right away, juice, bread, the whole thing. And it just means so much to him to have those relationships. And those relationships he's not experiencing right now. We miss the staff, we miss that weekly connection. And we're picking up our wings every week, supporting the business, but that connection is missing for us. And that's hard for Jack. It's hard for Jack's mom too. We look forward to those times. There's disruption of employment programs and employment for people with autism. There's discontinuation of respite that we count on for many people. Routines are disrupted. Incomes have been lost. And for our families, many struggle to begin with. And so to not have the income that's needed to support a family, that's living with autism, it's challenging. Many of us have been experiencing challenging behaviors during this time. People with autism, sometimes, those with language, those without language, behaviors can really bubble up just with frustration, with, physical issues that perhaps they can't express. And so they can become self-injurious. They can become aggressive towards others, and then trying to manage that in a situation where there's not a lot of outside support is hard. And then, of course, access to healthcare. There's been a lot of advocacy in Massachusetts, led by the ARC and others, around trying to make sure that we can be with our loved ones with autism if they're hospitalized right now. What does that look like? What do the supports look like? So those are some of the unknowns and the challenges that we're facing. And we're really trying to shape our advocacy around that on both the federal and the state level. And so today, we want to share with you some of the things we've been advocating around to try to fill in some of those gaps as much as possible right now. I encourage you, you're all muted and your video isn't on either, just to save bandwidth for the webinar. But if you have questions or comments, we want to hear from you. So please put them in the chat box or the Q&A, and then we'll answer them as we go. If it's something that we can answer broadly for the group, we will, but we certainly want to answer any questions. So please use that chat box. And also, if you have a really individual kind of situation and you're looking for an answer, you're looking for help, we have an amazing autism response team. You can reach them by phone. We have a line that's dedicated to people who are Spanish speaking, or if you prefer to email, you can email help@autismspeaks.org, and we want to make sure we're here for you and we're connecting you to the many resources that are available right now. All right, so what are we going to talk about today? Enough from me. So it's so good to hear from Jill, who heads our New England chapter. And if you want to get involved, we'd love to have you involved in our New England chapter of Autism Speaks. We're missing those activities that we usually have. Our family's been just feeling so sorry for ourselves because we didn't have Autism Awareness Day at Fenway this year. So we miss our New England chapter. We're looking forward to the walk in the fall, and we just miss that camaraderie. So thank you, Jill, for welcoming us. Dave is with us from our federal team, and there's a lot going on in DC right now. So I'm really looking forward to hearing from Dave about what happened yesterday and what's been happening over the last few weeks. I'm going to talk with you a little bit about things that have affected us on the state level here in Massachusetts. And then Jenny Green, who does community outreach for Autism Speaks, is going to share some resources that we've developed around COVID-19 for our community. So right now, Dave, I'm going to turn this over to you, and actually, I'm going to let you share your screen if you'd like for your slides.
Sure. Thanks, Judith. Great to be with you all. I'll get the share screen up in a second. So I'm with the federal team in our Washington, D.C. office. Been with Autism Speaks for about a year now, a little over a year. And prior to that, had spent over a decade on Capitol Hill working for a member of Congress from Connecticut. From Central Connecticut originally, so I wanted to just start by showing where my sports allegiances lie, because I feel like that's an important thing. And I know, like many of you, wishing we could be there at Fenway. Let's see here. I'm going to try to get this up and provide an update. So I'm going to try to I am going to try and get this going here, although Judith, I'm having a little bit of trouble.
You can sing Sweet Caroline while you're getting your slides.
Yeah, I like that. I like that. Okay, I think I got it here. Okay.
Oh, yay.
All right, perfect. All right, so let me just get the slideshow going. From current slide. Okay, cool. So what I want to do is just bring you all through briefly what has already passed related to the COVID crisis, what we've been advocating for at Autism Speaks at the federal level, and then where we think things are going from here. There is a ton of information here. I'm not going to get into every last detail, but if you have specific questions related to any of these bills, please don't hesitate to put something into the chat box or into the Q&A box, and we can try to answer them. So this is just really intended to be kind of a high-level overview, but happy to answer more specific questions. Okay. So beginning in March, Congress started passing legislation related to the pandemic. And the way that they've been referred to, they all have names, bill names, but they've been referred to in the order in which they've been passed as COVID 1, 2, 3. There's a 3.5, which we'll talk about in a second. And they all have different components to them. As you can see on the slide, COVID-1 was really the first opening salvo in terms of congressional action, and it was to provide some emergency funding for the public health response and some other provisions. March 18th, COVID-2 passed. This was the Family's First Coronavirus Response Act. Importantly, this provided emergency paid sick and family leave. And there's a lot more detail on that we can provide as well, but that was one of the big highlights from that, in addition to the other components that are noted on here, most notably the increased in, Medicaid funding. So on March 27th, the largest bill to date that's been passed related to the pandemic was the Coronavirus Aid Relief and Economic I'm having trouble seeing this. Okay. Sorry about that. Economic Security Act, the CARES Act. And this provided $2 trillion in funding. And this is a bill you've all heard about. It included the $1,200 payments. They've been called stimulus payments, economic impact payments to Americans, $500 for dependents under the age of 17, increased unemployment benefits, hundreds of billions of dollars for the public health response, and also to state and local governments. The Paycheck Protection Program, which provided $350 billion to employers in the form of potentially forgivable loans to keep employees on the payroll. You've probably heard more about this lately, which I'll talk about in a second. Billions of dollars for higher education, elementary and secondary education. And Judith, I know we'll talk more in depth about this later on in terms of what we're doing at the state level. And then extending the Money Follows the Person program through November. Again, all of these bills contain multiple different components. There's so much to them, and again, we're happy to answer more questions, but that's kind of a high level overview. And so going on to April 24th, COVID 3.5 passed, and as I mentioned, the CARES Act included the Paycheck Protection Program, those forgivable loans for small businesses. It ran out of money very quickly because of the high demand. And so over the course of a several week period, Congress negotiated an infusion of funds to replenish that program, and then also included some funding for hospitals and tests. I mean, significant amount of funding in the billions of dollars. And so that was the last action that was taken. But really, from the time that the March 27th bill passed all the way through now, there was an acknowledgement in Congress that there's going to need to be more done to address the very significant challenges that individuals and families are facing, that state and local governments are facing, that healthcare providers, small businesses, you name it, are experiencing. And so throughout this time, there has been additional conversation about what would be the next big relief package passed in Congress. And so throughout March, April, now, we on the federal team have been advocating with members of Congress for a number of different priorities. And I've noted a bunch here on this slide. So additional funding for home and community-based services. We know how important this is for everyone right now. And additional funding to meet the educational needs of students with autism. So this is both looking at the current needs in terms of providing additional funding to support the distance learning that we know is not the same, and not comprehensive in the least as compared to what students may normally be getting at schools, but at least providing some funding to bolster those efforts, and then really ensuring that when students return to school, that schools are able to quickly provide services for students who have experienced regression, which we know has occurred because of the fact that because of the lack of the comprehensive educational services that has been experienced during this crisis. Protecting the rights of students under the Individuals with Disabilities Education Act, IDEA. There was a lot of back and forth over the course of the month of March about whether or not Congress would waive any of the rights, waive any of the protections under IDEA for, to provide what they would describe as flexibility for school districts. We advocated strongly against that. And unfortunately, Congress didn't pass any waivers. They required the secretary to issue a report on any waivers that might be needed. The secretary's report came out in late April and said there wouldn't be any waivers necessary to the core protections of IDEA. So, of course, we thought that was the right decision, and it's certainly a good thing that a bad thing didn't happen. But we know that there are huge needs still, and so our efforts continue in terms of trying to do whatever we can from an advocacy perspective to assist individuals on the spectrum in terms of educational opportunities. Expanded access to telehealth services for healthcare needs and ensuring that providers have the tools to be able to appropriately deliver care in a telehealth setting to the, at least to the best degree possible during this time in terms of these telehealth services. Eligibility for the $500 economic impact payments for dependents over age 17. We've heard a lot from individuals and families across the country on this issue, and we have supported legislation that would correct this issue, where a lot of people were left out of the economic impact payments because of this, the law being written this way. According to caregivers of adults with disabilities, the same paid sick and family medical leave policies that are accorded to caregivers of children. This was a fluke of the March 18th law, where it wasn't clearly written that caregivers of adults with disabilities, who don't have the same access to care as they would previously, were not explicitly included in the category of individuals eligible to take advantage of emergency paid sick and family leave. It was allowed for the caregivers of children under the age of 18 whose school or childcare facility was closed, but not for caregivers of adults with disabilities. And so fortunately, the Department of Labor in implementing this did make this correction. We have weighed in, and they are allowing that category of individuals to take advantage of the provisions. And finally, preventing discrimination, treatment decisions, and care allocation based on disability. We came out and applauded the Office of Civil Rights at HHS for putting out guidance to ensure that medical providers and others were aware that they should not be discriminating based on someone's disabilities. So we've been very fortunate in Congress to have great leaders in Congressman Chris Smith and Mike Doyle, who are the co-chairs of the Autism Caucus. They've sent letters to congressional leadership advocating for many of these priorities. We've been in touch with a lot of members. Most recently, they led a sign-on letter to the congressional leadership advocating for these priorities. And I believe we, in a very short period of time, like a day or two, they were able to pick up about 40 co-signatories. So, these efforts continue. So what's next? So we did COVID-1, COVID-2, COVID-3, 3.5, and the next COVID bill is going to be COVID-4. This, as I mentioned, has been something under negotiation, I think probably from the time that the March 27th bill passed, and those negotiations continue. Just yesterday, House Democrats introduced the HEROES Act, which is a $3 trillion massive relief package. I believe it's 1,800 pages long. And so our team has been combing through it. There's a lot there. Across the board, from additional individual and family assistance to continuing the unemployment, the additional unemployment benefits through January, to housing assistance, to helping the Postal Service. I mean, there is a lot there. I'm happy to share summaries or anything more specific related to that bill. But I don't mean to minimize any specific portion of this by not mentioning it. It's just there's a lot there, and we could spend the next 2 hours going over the entirety of that bill. So I wanted to just flag a few priorities of ours that we just kind of touched on and that were included. There is a substantial increase in funding for home and community-based services and Medicaid as well, and that would go through next year, actually. There's $100 billion included specifically for education. I believe 60% of that would be for elementary and secondary. And that's in addition to the $1 trillion in like general assistance that the bill would provide for state and local governments. So we know that this is going to be a huge challenge, now and going into the next year, or probably two, for state and local governments to be able to make up for the lost revenue that's occurred during the pandemic. And so that's what this is targeted at. I mentioned that dependents under the age of 17 weren't eligible for the economic impact payments, $500 economic impact payments. This legislation not only corrects that, but actually makes those dependents retroactively eligible for that economic impact payment of $500. And then they, in this bill, provided additional $1,200 payments per person in a household, up to, I think, a total of $6,000. And so this group would be eligible for that as well. While the Department of Labor allowed for emergency paid and sick family leave eligibility for caregivers of adults with disabilities, it's important to note here that the bill here would make that clarification in statute, which is important. And then finally, there's $10 million in the Developmental Disabilities Act activities, which we hope could be used to assist our community, at least a portion of which. So where do we go from here? So I recognize there's a lot of very good things and positive things that are in this bill. And again, we're going to continue to comb over it to find other areas as well that we know will be beneficial for the community. The House is scheduled to vote on this bill on Friday, but from there, the path is unclear. There isn't an agreement with the Senate on this bill. And I think that this will be subject to a significant amount of negotiation over the next few weeks or month. This is really the opening salvo in terms of actually having a bill put out there, but I wouldn't assume that everything that I just discussed here is what ultimately ends up becoming law. And so, I think there are some very positive steps forward in this legislation and things that we're going to continue to advocate for. But I just want to make it clear that this is by no means final yet, and there's still going to be a lot of back and forth before we get there to a final bill. So anyway, I know there was a lot of information. Again, happy to answer more specific questions, and thanks again for being with us today.
All right. Kelly, do we have any questions that we need to reference?
We do. We have a couple. The first one is from Mike, who is one of our advocacy ambassadors. Thanks for joining, Mike. He's a Floridian now, but he's from Massachusetts, and he knows about a Dear Colleague letter that we were asking for help getting additional members of Congress on last week, and he wanted to know, Dave, what the status of that is, how many people signed on.
Yeah, so thanks, Mike, and I'm glad you're able to join us today. And thanks to everybody who helped. We had a very quick turnaround on this letter to try to get some additional signatures on it. And so my last count was, I believe we had 38 signatories on the letter. And when you include the two authors, we're at 40. For a quick turnaround like that, it was a great effort, and we really appreciate all of the advocacy ambassadors and advocates who were able to write into their members.
Thanks, Dave. And it certainly looks like we were heard, and those members of Congress were heard with some of the content that we're seeing in the proposal here. One other question is about the amount of the Home and Community-Based Services Act. Home and Community-Based Services ask in the bill. Is it $50 billion or some other amount that is being put in, if you know off the top of your head?
I don't have a dollar figure off the top of my head because I think we were looking at more of a percentage increase in terms of the payments to state Medicaid programs. So I think when you look at Congressman Smith and Doyle's letter, which we were obviously very supportive of, they were asking for a 15% increase for HCBS. So I don't know. And so the bill that was put out yesterday includes a 10% increase specifically for home and community-based services, and then a 14% increase for FMAP, like across the board for like the state Medicaid program. So I think, state by state, you'd have to figure out like how much that worked out to. But so anyway, long story short, I don't have a specific dollar figure, but the percentage increases will amount to a lot of money. Yeah.
Okay. Thanks, Dave. We had one other question that was in the Q&A box about help with obtaining devices, but that one got answered, and it's our team is happy to help. So we directed the person there.
Great. All right. Thank you, Kelly. All right, and thanks everyone for the good questions. All right, so let's talk about what's going on in the Commonwealth. We know Governor Baker's on TV regularly filling us in about the gradual reopening, and we know that we're all kind of holding our breath, and there's lots of advocacy going on. So I'd like to talk with you about some of the things that we've been focusing on at Autism Speaks. So when we think about the autism community, the diverse autism community, level 1, level 2, level 3 autism, people living in rural areas, people living in urban areas and suburban areas, and different socioeconomic situations. And we want to make sure that our advocacy touches on all those critical things. So we kind of, as we moved into the COVID era, focused on healthcare, home and community-based services, which we've been talking about so much already, and then also what's going on with special education and early intervention. So with regard to healthcare, I'm going to move through these quickly because I know it's hard when we're just talking. Mass Health actually has been approved for an 1135 emergency waiver. And so for those who use Mass Health for your healthcare, to go to the doctor, to get services that way, there's some flexibilities. The emergency waiver was approved on March 26th. And so prior authorizations are adjusted, extending pre-existing authorizations. There's suspension of pre-admission screening and annual resident reviews. Timelines have been modified for fair hearing and appeals. Some of the provider enrollment requirements have been modified, and different settings have been allowed just to allow some flexibility. And just so you know, we're going to provide this webinar to you after it's over. We'll email all the participants. We'll have a link to this, and we'll also have a recording. And all these slides have links in them. So if you really want to get down to the details, because I'm moving through this quickly, there's a link here where it says additional information can be found. There's information from the waiver. All the information about what was authorized in that waiver can be found there. But these are just kind of the general things that have been adjusted. All right. And also, you know, we have moved into this world of telehealth like we never have before. CMS, the federal agency that oversees Medicaid and Mass Health, early on said, you know, we really want to move to telehealth so we can make sure that our community is accessing services. And it's important not only to people who go to the doctor, no federal approval is needed, as I said, because CMS told the states, like, let's just do this. On the state level, Charlie Baker executed an order early on, just expanding access to telehealth across the board for commercial insurers, and also the Group Insurance Commission, which covers all the state employees here in Massachusetts. He even mentioned self-insured plans, which I found interesting. And then I think most of the plans here are providing telehealth to people with autism. If you were having issues with telehealth, let us know. And I know Terry Farrell was on this webinar. I saw her. She's from the Autism Insurance Resource Center here in Massachusetts. They're doing an amazing job providing information to you around telehealth and services. So we are all here to support you. And I will say too, you know, telehealth, as I mentioned earlier, can be really helpful. It can also be next to impossible, depending on where you are on the spectrum and how you access information and how you communicate. So we know it's not an answer for everyone, but it is so important to have that option, and we're hoping that it's helpful for many. As I mentioned before, it covers visits to the doctor, but it also can cover services like behavioral health treatments, including ABA, therapeutic services, speech, OT, PT, and also psychological and psychiatric care. Okay, so moving quickly, we've talked a lot about home and community-based services. HCBS is usually what it's referred to when we're talking about it on the federal level. Here in Massachusetts, that's all the services that you might get through the Department of Developmental Services, DDS. And Mass Health also too provides, you know, some waiver services. And one thing I want to mention to you all is if you have a child with autism and you live in Massachusetts, please go, if you just Google the Department of Developmental Services, go ahead and sign up your child. It takes a little bit to fill out the paperwork, but it's really important that you enroll with DDS. And it's something, I'm a parent, I live here in Massachusetts, and I didn't fill out the paperwork till my son was probably 7 or 8. And it's just kind of something that's always on the to-do list, but it's important to connect with DDS and then work with your Autism Resource Center to arrange for services that you can get outside of your IEP services. So just a little aside there. All right, so through DDS, there's a lot of waiver services here in Massachusetts, and they fund like our day programs. They fund programming for adults. The group homes that we have, they receive waiver services through home and community-based services through DDS. And so when COVID-19, you know, just took over the world, CMS, the federal agency for Medicaid and Medicare, reminded everyone that there's flexibility around something called Appendix K, which I'd never heard of, but we did learn quickly about it. And there are many flexibilities for waiver services through Appendix K when there is an actual emergency like a pandemic. And so we reached out to Secretary Sutters and the folks at Mass Health and DDS to ask that Massachusetts apply for Appendix K flexibilities. And we asked for some specific things, some of which were granted, some of which weren't. But this list is very long. I'm not going to read all of it to you. There is a link to the Appendix K, which was approved. It was just approved last week. So all these flexibilities are just now going to be rolling out in your waiver services. So for example, if you have the Children's Autism Waiver, which is a small waiver here in Massachusetts that serves children of a certain age, they're increasing the maximum age and they're increasing the budget limits somewhat during this time. They're allowing for waiver day services to be provided in participants' homes, including in group home settings right now, which is a little different. So things like that are happening. They're allowing delay of completion of the annual level of care reevaluations and assessments. They're providing for retainer payments for day hab supplement services, so that day hab services can stay afloat right now, and even including things like home delivered meals, medical supplies, equipments and appliances over and above what are usually in the waiver services. And also, someone asked about assistive technology earlier, for those who might be getting services through DDS, and DDS might not even call it a waiver service, but if you're getting funding from DDS, there's a high likelihood it's going to be funded through a waiver. You might not even know that. But anyway, if you're getting services through DDS, some of these flexibilities might appear. So it's good to be aware of them. And if you need these flexibilities, to reach out and ask for them. Implementation is occurring now. And then finally, the other area of focus that we have is related to special education and early intervention. DESE has come out most recently on March 26th with frequently asked questions for schools and districts. And I encourage you to go to this link and read those frequently asked questions. There's a lot of information here. I pulled just a snippet out of it, just because there's so much information there. But they point to the U.S. Department of Education and how they've stated that during this national emergency, school districts must provide a free and appropriate public education consistent with the need to protect the health and safety of students with disabilities and those individuals providing education, specialized instruction, and related services to the students. So DESE has on their website, and if you go to this link with the FAQs, you'll go to the DESE website. They have PowerPoints they're posting pretty much every week just to talk about what their leadership is considering week to week as they're trying to figure out what to do with provision of services. And there's so many things to consider here in Massachusetts. There's, the public school programming, the remote learning, how that's working for some, how that's not working at all for others. And, when you're thinking about not only the students and the challenges that their families are facing as they're trying to access remote learning, and perhaps the parents are trying to work too remotely. And then you think about special education teachers who are on the other side trying to provide those services, and they may have children at home too. It's a very complicated situation. We also have programs like our private schools where students attend. Many of them go year-round. What's going on with those services? How are they able to access them? What's going to happen with the school calendar? Lots of things up in the air. There are some things we do know, however. One thing we know is how much money that Massachusetts received from the CARES Act that Dave talked about earlier. So for K through 12, we received $199 million. And in that K through 12 funding, there is a provision for special education services. Post-secondary has received $254 million, and the Governor Baker received almost $52 million. That's discretionary for use in education. And in that discretionary direction, he's really supposed to, according to the CARES Act, focus on groups that are marginalized, lower socioeconomic situations, special education, things like that. So we're advocating that that funding specifically be used to help in some ways. One is, as mentioned earlier, trying to make sure people have access. If you have a family who's living in an apartment somewhere and they've got 4 kids and they're all sharing one computer and the Wi-Fi is inconsistent, it's going to be really hard, for all of them to access education, and even more complicated for those who are trying to access special education. We want to think about what's happening with our kids in early intervention right now with our little ones. The the best thing is to do what's appropriate for the individual, but we don't want any children just pushed into special education during this time if they haven't received the appropriate support to move from EI into special education. We're thinking about the services that our students are missing. Even in the best of programs, our students are not able to receive the services and supports that they need. There are things that are just falling by the wayside, and we want to see that addressed as soon as possible. We don't want to kick the can down the road and think about, oh, let's just think about compensatory services later. We want to start getting those services pulled in now, as much as is feasible and is safe. Of course, we're really in a crisis here in Massachusetts, so safety is so important. But as soon as possible, we want to see our students accessing education because they're losing opportunities right now. And then we're also thinking about those who are transitioning out of special education into adulthood. I serve on the Massachusetts Autism Commission and have also been very involved in the subcommittee there that focuses on transition to adulthood, the age group like between 14 and 22. And so we want to make sure that the appropriate services are being provided now, and that also that population is not being pushed into the adult world without the appropriate supports and transition services available to them. So those are things we're focusing on. From an education early intervention standpoint, I'm guessing many of you might have many other things to suggest about what we need to do. And so please know that we're here and that we definitely want to hear from you about things that we could be advocating around. You can follow us on Facebook, please do. We have an Autism Speaks Advocacy Facebook page that I encourage you to follow. We put regular updates there. We also are on Twitter and even Instagram. So follow us at Autism Votes, and please just stay in touch with us and let us know what you need during this time. I really appreciate you all taking time to listen today. And so before I turn to Jenny to talk about community outreach, I don't know if we have questions that need to be answered, Kelly.
We do. We have some great questions.
Okay.
The first one, Judith, I think when you mentioned Appendix K flexibilities, you gave some good examples, but if there's any more you or Dave want to expand on for this one. The question asker is confused by the need for home and community-based funding when people are being asked to stay home and work remotely and when most community sites are closed. Can you explain, what those dollars would go for?
Well, for instance, the services that might be provided in a clinic, usually or in a day program, can be provided now in an alternate setting. So they might be provided in your home. Of course, you have to walk through the whole maze of considering an essential workforce and safety, personal protective equipment, having someone come into your home. That is happening in Massachusetts. People are receiving some in-home supports in that way. So you're going to be seeing that happen for people who truly need those home and community-based services right now. So they're available in alternate settings with certain safety protocols in place.
And
Thank you. Oh, go ahead, Dave.
And I would just add from a federal perspective in terms of what I was talking about in the discussion about the HEROES Act and some of our advocacy. A lot of what we're looking at in terms of like pushing more federal dollars out for this is related to the things that Judith was just describing, ensuring the continuity of a workforce, ensuring that that workforce has the proper protective equipment that they need. And then for a variety of other purposes, but basically to ensure that people are able to access these services, that they're able to access them safely, and that that there is a continuity in terms of the services provided. Normally, I would try to provide a summary list of things that are in a bill rather than sending a bill, like a full bill text to you all. But since this just came out yesterday, and I do think that this is written in somewhat plain language as opposed to some other times where bill text isn't, I'm going to direct you here in the chat box. If you go to page 294 on this link that I sent, you'll be able to scroll down and see in the HEROES Act what some of those additional HCBS dollars, or at least in this bill that's been proposed, would be intended to be used on. So you could see kind of what the bill authors were talking about in this particular bill.
Great, thanks for that additional info, Dave. Another question, has advocacy focused on the licensing boards in Massachusetts with telehealth providers who may be working with clients in Rhode Island have had difficulty getting licenses in Massachusetts to continue working across state lines?
Oh no, I actually have not heard of that. So if let's connect after. I'll put my email address in the chat box if you want to connect with me, and we'll definitely look at that situation and see if there's something we can do.
Great. Is there a sense of how long the governor's order allowing telehealth for ABA and other services will be in place, or when it might be rescinded?
So a lot of the language around, things that are being provided, say that they're provided in Massachusetts during the time of the pandemic, which I think here, is quite an extended period of time. And we're having conversations with providers and with families about what makes sense for extension of telehealth and advocating around that. I'd love to hear from all of you. We definitely think that the option of telehealth is critical for access for our community. We want to make sure that at the same time, the provision of services, the quality of the services are not eroded, and that the health plans don't try to dilute services in some way by insisting on telehealth delivery. So it's just that balance of making sure that quality is protected while access is expanded. So that's the advocacy that we're doing around telehealth.
Thanks, Judith. There's a question about pre-K, and is pre-K excluded from any of the funding that has come down or may come down from Congress?
Well, that's a really good question. I know we talk about K through 12. I think with special education, though, of course, here in Massachusetts, it starts at age 3, and federally too. So I would think that the funding would count with that, but I think that's something we need to double check on.
In response to Catherine's question about crossing state lines for provider credentialing, Terry says Massachusetts has waived credentialing for out-of-state ABA providers through July 31st. So just an FYI.
Thank you, Terry.
Yeah.
Autism Insurance Resource Center, Terry Farrell.
She also says one of the biggest challenges her office is hearing from ABA providers is the lack of personal protective equipment. So that those dollars definitely will be relevant to get help in that way. We do have a question about in the post-COVID environment, if any of the new benefits will affect current services that were approved before the COVID situation happened. I don't know exactly what services are meant by Conrad, but
I don't think they should. Generally, the Appendix K provisions, the provisions, that DESE is providing, those are all specific to the period of the pandemic. And then the goal, of course, is to get back to where things were, prior to this. So,
yeah.
And I'm not sure if this is specifically what you may have been asking about, but I know it's come up in the past, the $1,200 economic impact payments and the $500 for dependents. The law was specifically written to ensure that those aren't taken into consideration for eligibility for federal programs. So I just wanted to make that note. It may not have been what you were alluding to, but others have asked in the past.
Thanks, Dave. We have one saying that her son is 2 and was progressing well with EI and ABA home visits before the lockdown. Telehealth are just not being as effective and are, a lot less hours for this child. Will the Appendix K waiver allow for home visits to start soon with proper protection?
So I think with early intervention, the Appendix K provisions don't apply to that directly. But I think where we need to advocate is specifically with early intervention here in Massachusetts about what they're able to do. And I will say this is a consistent concern that I have heard from our families here in Massachusetts, that the provision of early intervention through telehealth is just not the same. I know that they're trying to balance safety and the essential workforce and the access to equipment. So that's definitely something that we're advocating around, just access to EI as soon as possible and as soon as it's safe. It's so hard. This time period is so important for young children with autism. You cannot get this time back. Early intervention is critical. So we need access to quality EI just as soon as it's safe and possible.
Yeah. Thanks, Judith. And Stella, the person who asked that question, if there's anything our autism response team might be able to offer in terms of any guidance of resources or other things, please feel free to reach out to them too. The last thing Catherine noted, I think this is back to the provider across state line credentialing. She said not psychologists. So what may cleared for ABA providers may not be applying to psychologists right now.
Right, and that's important for a big part of our population. So Catherine, I'll put my email address in the chat box. If you want to touch base with me, we have relationships in Rhode Island and Massachusetts, and we can certainly see what we can do around that.
Thank you. That gets us through the questions.
Okay, great. And now we're going to talk about resources for the autism community that are available during the time of COVID-19. So at this point in time, I'm going to turn it over to Jenny Green. And Jenny?
Hi there. I'll spend the last few minutes just sharing where to find our COVID information and resources. And you can go to the next slide. Thank you, Judith. So we know that so many people are impacted, especially those with autism and their families, and they're being impacted in very significant ways. You know, you guys, and Judith touched upon this earlier, but you're experiencing disruptions in vital services and coping with that uncertainty of what comes next. So in these times, you may be experiencing some of these changes listed here, or you may be experience some of these changes and challenges. So we just want you to know that we are here and we are committed to help supporting you and your family. Next slide. So we spoke about this a little earlier as well, but we mentioned that the autism response team or staff members specifically trained to provide personalized information. They provide guidance and personalized resources for family members or individuals on the spectrum. And the autism response team can also answer questions that connect you with tools and resources, and also help you find those services and supports in your local community. I did want to mention that they do have a dedicated Spanish language toll-free number, and you can always reach out to them by email at help@autismspeaks.org. Next slide. So as you, we have some COVID-19 specific sections on our website, and these are updated regularly, just so you know, and you're going to find numerous links here. So just listed here are just a few examples of the resources, and we are updating the site regularly, so make sure and share this link to everybody and anybody that you might that'll benefit from these resources. So once you open the Autism Speaks resource on the main page, you're going to see a gold banner up at the top of the page, and clicking on this banner is going to take you to the COVID-related resources. And here you're going to find numerous links divided into topics such as families, adults on the spectrum, and also educators and professionals, and also advocacy like we're talking about today. Also mentioned is some examples of resources dealing with school closures, what the autism community should know about, and also another great resource listed here is our Facebook and Instagram channel. So I encourage you to join your local Autism Speaks Facebook group in your area. And earlier this month, as you see noted here, we actually launched this wonderful new resource This is the Autism Certification Center and Autism Speaks teamed up to make over 30 hours of online learning available to the autism community. And this is at no cost to you until June the 1st. So next slide, sorry. And last, I just wanted to mention that there are, other than the COVID-19, there are many other resources available that we have to offer. So on the main page, you're going to see the Help and Information tab. And once you hover over the topic, there'll be a drop-down box, and simply click on the information by topic, and you're gonna see this screen pop up. So to help you search with support, we've actually organized this, the resources and information by category. And you'll see here down at the bottom in blue, we have categories such as financial planning, we have safety, we have technology, and transition to adulthood, just to mention a few. And that's all really I have, Judith, and I'll turn it back over to you to close us out.
All right, wonderful. And I know we're coming right up to the hour. I want to thank all of you for joining us today. Just a reminder, we will be following up on questions, anything that wasn't answered during this time. We will be in touch with you to answer your question. We're going to be sending all the materials out. Thank you so much for joining us today and being part of the advocacy solution as we experience the challenges related to COVID-19. Everybody, please take good care, and we will talk again very soon.